Hello and welcome to Telehealth with Microsoft Teams, where we're going to talk about remote treatment in a face-to-face industry. Well, going remote and telehealth is not going to be anything new for the medical industry, especially since the pandemic a little over a year ago forced everyone to go remote. Telehealth and teleservices for the medical industry has been around for actually a couple decades, but some of the research has found that there wasn't a lot of adoption, and in fact, one provider that was interviewed in a study said that, well, there was 10 years of transformation that happened inside of 10 days in the medical industry on all sorts of fronts. So we're going to talk a little bit about those lessons learned, as well as some research and things to consider. To put this session on today, we actually interviewed some medical practices and some operations folks at medical facilities as far as some of the lessons that they had, some of the tips and tricks that they've learned through the process of telehealth over the last last year and a half, in particular since the pandemic. We've also done some research on different government resources and insurance resources relative to, and some studies relative to telehealth and some of the impacts that telehealth can have. So for those of you who are listening, you're thinking, we already are doing telehealth, and that's great. We are just trying to share some of the lessons learned that we have found from some of the different research we've done and the providers that we've spoken with, as well as trying to give maybe some nuggets of information or some tips and tricks that might help you if you haven't experienced some of this pain or some of these items in your practice. The other little public service announcement or caveat that I would like to give is that there are so many different types of medical practices out there, from specialties to general practices, that it would be impossible to specifically address how telehealth or teletherapy or telepsychology, et cetera, could apply to your world exactly. So we're going to try and have some general tips and tricks and some general things to consider for you to apply that to your practice and to your world. So by the way, I'm Nate with MyTech, and I'll be presenting today. And behind the scenes, Stephanie Kingsley will be producing. We're both from MyTech, and thanks for joining us today. All right. With that said, here are the key things we're going to touch on today. We are actually going to review some of the core problems and challenges and opportunities that are presented by telehealth. And again, when I say telehealth, by the way, I'm lumping all those. There's lots of different phrases that are used. Again, telehealth, teletherapy, et cetera. I'm lumping that all into telehealth, even though you might use a slightly different term for your specific specialty or practice. Then we're going to do a demonstration. I actually want to show you some of the ways in which you might be able to use Teams to solve some of the problems that have been addressed, as well as to help maybe think through some of the ways in which you might be able to prepare your practice to use something like Teams. And I'm not saying, by the way, again, we're Microsoft practitioners, and so we like to illustrate and show the features that Microsoft Teams can bring to the table. However, one of the things that we've talked to a lot of other organizations about with their Microsoft 365 migration and tool utilization is that they want to try and consolidate the number of tools that they have to manage. So this is one of those illustrations, and why we're holding this session today is really to give you an option that if you're already using Teams internally for maybe instant messaging, for posts, and for video conferencing internally, if you are using yet another third-party tool for other video conferencing or other telehealth, it might be an option to be able to consolidate the number of tools that you're having to manage. So that's just an illustration why we want to put this on. If you're already having successful telehealth practice with another tool, I'm not saying you should change that, because actually some of the things that we'll be talking about today might be things you can actually apply to that other tool. So anyway, we're going to go through a little bit of a demonstration about how we might be able to address some of the telehealth challenges and opportunities, as well as then at the end review some of those tips as far as what Teams and telehealth, how that might be able to employ telehealth in your practice with Teams, and some suggested items there. And then finally, we'll open up for some questions. And if we have time, I have a little bonus content if there's questions or if there's a time to present it. But otherwise, let's move forward. And before we dig in, I always like to say, let's have 1 minute about MyTech. MyTech is a small and medium business technology and business consulting organization. We work with organizations from 15 to 500 people that are technology users that typically have no IT staff to a small IT staff on their team. Over the last 20 years of being in business, we've learned a lot about a proven IT strategy that can deliver proven and consistent results for you. Is it the only IT strategy that exists? this, of course not. It is just one that we've learned works really well, and we know that working with our clients, we can achieve consistent results. Ultimately, because that removes IT challenges for you, so you can focus on the things that you're great at, which is serving your customers better or your patients better and being more adaptable to other business challenges, like adapting to a pandemic, for example. We know you throw all that together, we know our clients can achieve 4 times more value and productivity from their IT investments. So if you'd like to learn more about that, please raise your hand. We'd love to have a conversation. However, I know that's not why you're here today, so let's dig into the content. All right, so we're going to talk about telehealth problems and challenges. Now, of course, whenever you talk about problems and challenges, the reverse of that sometimes is opportunities, but we're going to try and break them down into several different areas here. Again, there are also some sources that I'm going to reference here, and we're going to send those out in the follow-up email. They'll be in the chat or the comments here on our YouTube channel. All right, so first of all, it's obvious that we all had to transform to serve during the COVID pandemic. So again, that was the comment that was made, which is 10 years of change in 10 days happened to the industry. But one of the things that I thought was that was nice is that the way that really forced government and medical to work together to be able to change things. Some of those, is the last bullet notes, is that being able to get reimbursed. There was changes that had to be made so that doing telehealth visits is actually something that could apply to health insurance, and that your health insurance would cover those types of visits. So that's an example of where I think that transformation, it forced some normalization of telehealth, as well as forced the industry, both medical and government and insurance industry, to all work together to be able to adapt to being able to normalize telehealth. One of the things that we identified in some of the telehealth problems and challenges is that there's not every issue can be solved remotely. In fact, the people with whom we spoke, they commonly reference that if you have to do a procedure, obviously that's not something you can do remotely, but oftentimes the initial diagnosis or the initial visit to be able to, identify a plan for a patient is something that was oftentimes difficult, especially if it's certain pain management or dermatology facilities or others, if you need to be able to see the patient or do exams or x-rays or things like that, then that's obviously not going to be something that's helpful for remote. But what they did find is that some of the maintenance or the regular check-ins that happened is something that actually was really easy to be able to do remotely, presuming that you could get the patients connected, which is one of the other problems. But yeah, it was just looking at the type of services they provide and thinking about, well, is this something that can be provided virtually effectively? And so a lot of teletherapy, telepsychiatry, mental health, but even other physical ones, if it's more of a maintenance or maintain or follow-up visits or outpatient, that's actually something that has been very successful using telehealth. And again, I don't know every practice that's listening or might be watching this in the future, and so I'm not trying to address every single practice's potential ways in which they might serve remotely. However, just recognize that there's different types of services, of course, that can be addressed remotely and some that can't. One of the things that was also consistent in the research that we did and the folks with whom we spoke is that they had to not just choose to do telehealth, but they had to figure out how to help patients be ready for their telehealth session, because sometimes go so far as actually help them download an app on a mobile phone or something like that. So we'll go into a little of those settings, but even some of those things, for instance, making sure that they have the ability to connect remotely. They have sufficient bandwidth. Do they have a device from which they can connect? Do they have the app downloaded that they can actually use? Do they have a place where it can be confidential? This gets into the interior security and confidentiality, but one of the studies talked about how there are certain people that maybe they would try and take a telehealth session from their car, or they couldn't find a confidential place in their home without distractions, either kids or a partner or a spouse. So they wanted to be able to make sure and talk about that up front and have kind of a different check-in session, or a preliminary check-in before their actual session to validate and check in on those variables to make sure that telehealth was a viable option for them and to make the session optimal for them. So security and confidentiality, that was the other one that was significant. Ensuring that you're using a tool that at its core is secure. At its core, it meets HIPAA regulations. So that's definitely one of the ones, as well as I mentioned, checking in with the patient, especially the different types of services. Some patients might want to involve their family, or they don't mind if their family overhears or the people around them, but some people might not. And so validating that they have a place where they can actually do that safely and securely was one of the issues that was definitely mentioned that it was worth a mention here. Okay, then adjusting practices. This is actually something where, again, looking at the workflow, normally if you're having a patient just come in, your normal check-in process works. However, what happens when it's a telehealth session? So how did you adjust your practices? And again, many of you have probably already gone through this, but this is just something I wanted to call out, that the folks with whom we spoke said that they had to adjust. They had to have a person or people that were designated to not only change how their workflow, so they had to kind of flag, hey, this patient hasn't yet had a telehealth session. Since that flag is set, we need to make sure that we have someone reach out and contact them and have like a person reach out, whether it's, again, helping them download the app on their phone, whether it's like providing some content that's about, hey, here's some tips and tricks about having a successful session, that might also include good lighting, so that, you know, the light's not behind you so that you look like you're in the witness protection program, but you can actually have lighting to see the patient. Things like that, just looking at what practices do you need to adjust internally, as well as, you know, one of the comments was too is that some of the telehealth video conferencing capabilities tools, they don't integrate. Very few of them integrate with your EMR or EHR, and so what does that do to make sure that you have to, if you put notes in there, you were doing some chatting or something like that, or a document was shared or a picture was uploaded, you know, making sure that there's a process by which you might upload that into the your practice management or the EHR or EMR system. Finally, again, touching base on the getting reimbursed. I know that different insurance carriers have different rules and regulations. Different states have different rules and regulations. So, you know, each individual practice is going to have to look at this and make sure. Now, right now, there's still some emergency orders in place. I don't know how and what those are going to change. We have no control over that, but that's something that I hope it seems like is to stay, but there's probably likely to be some changes based on lessons learned over the last 15 months of the pandemic. So, all right, those are some of the key problems and challenges as far as how do you try and address those things and be prepared for those so that you can actually be productive with your providers and give your patients a good experience and your team a good experience of being able to help your patients, so you're not frustrated with some of the technology challenges that inevitably would come up with a telehealth session if you don't go through some of these steps. All right, so let's talk about some of the opportunities. So those are some of the problems and challenges that were presented, but some of the opportunities that we found in some of the research was there's an opportunity to increase convenience for routine check-ins. So if you're going through regular maintenance, and if someone doesn't have to necessarily travel as far or leave work or provide childcare, because, you know, they're their primary childcare provider, to be able to come to an appointment, you can actually increase the convenience for routine check-ins for your patients. You might actually, one of the other things that we heard was that, you know, if there's certain types of practices might need or not necessarily require, but they might like, or it could be beneficial if there's family support. Well, if some of those check-in visits over time, if you're trying to combine and coordinate the resources of multiple different people, you can increase family support involvement when that's a part of the equation. Again, that's not always the patient isn't always comfortable with that, but in some practices, that's actually something that I know could be warranted. I mean, I've experienced it myself with my family, that it's sometimes difficult if you're trying to go to the doctor at the same time versus if you're able to do some telehealth to get those updates. The other thing, that there are studies around decreased missed appointments, that there is a high rate of, in some practices, as much as 60% no-show rate for appointments. And that was in the teletherapy and telepsychology area in particular, but they found that some practices, you know, took a 20% no-show rate down to nearly nothing when they incorporated the ability to have virtual visits and telehealth. So that's something that, again, depending on your practice, you can decrease missed appointments, because some of those even said the decrease in the studies was that sometimes the most common thing was that, or it's as simple as, I needed a ride and they didn't have reliable transportation for whatever reason. And so it's not, if we can create telehealth opportunities to be able to minimize folks having to miss a critical appointment just for something as simple as a ride, telehealth can help do that. The improved access for patients. Well, this is also similar to decreased missed appointments. One of the things we found is that, if there's specialties, I know that we definitely work with certain practices where there's some specialization where there's patients that are all around the country and sometimes all around the globe. And so how can you as a practice, if that's something that applies to you, or if you can extend your services beyond your four walls, or extend your services to those that can visit you and join you remotely, even though they might have to initially come in for a diagnostic, it's going to be cost prohibitive for them to continue to be checking in with you unless you can enable some sort of telehealth. So that was one of the ones that we found as far as an opportunity for folks to expand, as well as even for folks with physical limitations. One of the ones that was also an example was physical therapy. Instead of having maybe 3 times a week visits in person, being able to do every other session in person, so you can improve access for those patients, because if they're going through physical therapy, if they can do some of that physical therapy at home, when part of that physical therapy might be a challenge for them to get to the office or get to the appointment, that's an opportunity to improve access for patients as well. And then, of course, if you can expand beyond your geographic limitations, we touched on that a little bit for improving access, but of course, check with the different states and insurance carriers that you work with, because of course they're going to have different regulations and rules that you're going to have to follow. All right, so those are some of the key challenges and opportunities that we uncovered in doing some research. You're probably aware of a lot of those. We're hoping that there's at least a couple nuggets of information that you can take away from this if you're in the healthcare industry, as far as what this might look like for you. So let's dig into the demonstration. I've got a few things keyed up here that I'd like to show that are things that you may or may not have seen before relative to considering Teams as your telehealth opportunity. Okay, so let's move over. So I'm going to open up. I have Outlook. So let's just start. Again, there's many other tools that are out there, third-party tools available. I'm not going to go into all of those because I'm not familiar with all of those. We're not experts in all of those. But this is an opportunity to potentially consider Teams, especially if you're already using Teams, to consolidate the number of tools that you're using. The other thing that we've found is that there's not a lot of telehealth tools that integrate with EMR, EHR. There are some out there for sure, but this is something that, again, if your practice doesn't require that level of complexity, and I don't know the cost of those tools, this is something you're already paying for. It's something that might be able to work for you. So, all right, so I'm going to start, and there's either way you could do it. You could do new meeting here or new Teams meeting. I'm going to go ahead and hit new Teams meeting here. So it's going to pull up an appointment, and I'm just going to set test telehealth session. All right, I'm actually going to invite myself, except right now in this environment, I'm actually logged into our demo environment. I'm going to invite myself from my tech, so not in our demo environment, so I'll be able to join as a guest. So because I'll be able to join as a guest. And so a couple things I wanted to highlight here when you do this. One is that it provides a link automatically by default. Again, if you're familiar with Teams, great. If you're not, here's a link to join the meeting. And then it also provides a call-in number, and this is a public service announcement. If that you don't get the call-in number unless the originator of the meeting or the appointment actually has a license to be able to turn on the dial-in option. So it's an additional license, but it only has to be for the person that creates the meeting. So it doesn't have to be for everyone in the organization to be able to enable a dial-in. So the other thing is, I also understand that because there's not always necessarily an integration, and definitely not that I'm aware of with Teams, even though I think there's some ones you might be able to write if you're so inclined, but if you wanted, you could basically copy and paste this. And I actually put together just a quick Word document so that I could actually paste this here, just like it could be pasted into an EHR, EMR, if there wasn't any integration between Outlook and your EMR, EHR. So again, this is just the link. It's a unique link that you can follow. So that's something that if you're trying to also, if there's no integration, even calendar integration between those systems, this is a way where you might have to, part of that process and workflow might be copying and pasting this to make sure folks can access depending on how your workflow operates. So that's just something I wanted to show. It's as simple as a copy and paste if that's something you're doing. The other thing I wanted to show, going back to Outlook, is and the calendar appointment, is that there's something up here that you might not have seen before. This is relatively new within Teams, is there's an option to set settings for the meeting. So I'm going to click on that, and you say it's an option to do meeting options. So I'm going to click there and open the window on my other screen. So I'm going to pull that over here. And so this is the meeting options. And so here's some tips that I would strongly recommend if you're going to use Teams, and if you haven't looked at this before, is that who can bypass the lobby? You know, for security and confidentiality of your meetings, I would not recommend anyone outside your organization be able to bypass the lobby, even though you could set that if you wanted, but I'm going to say people in my organization. So if there are people from my organization that are joining, they don't need to go into the lobby. They don't need to be admitted from the lobby. But I do, so I think that's important. And I don't like it when callers can bypass the lobby, because let's say you have a family member dialing in. I sure want to know who that person is that's actually attending versus just letting, if someone uses that dial-in number, to be able to call in. I do like it to announce when they join or leave, not a big deal, but the callers, you don't necessarily see them, you don't see them at all because they're just calling in via dial-in if you happen to allow that. Who can present? You can restrict this if you want. I don't mind if it's everyone for this sake, but I do want to also touch about allow meeting chat. This is, to me, I believe this is, in my opinion, it's a security and confidentiality thing, because you can come down here and turn it on, which is the default action, or you can turn it off, or you can say in meeting only. You know, one of the things when we talk to some folks, it's a common practice if you're working with a patient remotely, is they might want to upload an image or a file or something like that securely. This is actually a way in which they could, if they're in the session, where they could actually upload this to you. And so I do like turning it on, but no, if you turn it off, you're also turning off the ability, I'm pretty sure, this is the bonus content that I had, by the way, is to show the in meeting versus the disabled. But so I'm going to put in meeting only for this setting, and then allow reactions. That's fine in the chat. So basically this is where you can allow chat or not. So I'm going to go ahead and save. Very good, done. Close it up here. Now I'm actually going to go ahead and send this message. I'm actually going to schedule this just so it's adjacent to another appointment on my calendar, and I'm going to hit send. Okay, so now that shows up on my calendar here. So what I'm going to do is I'm actually going to browse over to I have Teams open up in a browser. So notice this meeting just popped up here. So I'm actually, I'd strongly recommend, if you're the creator or organizer of this meeting, that use the Teams app to actually hold the meeting if you're holding a telehealth session. However, because I'm using Teams to present this content, I'm actually going to use the browser instead of the app to be able to present. So that's why I'm pulling up the browser view here. So I'm going to pull up the telehealth session. I'm going to go ahead and join this here. Not going to allow the camera because I'm already showing the camera, and I'm not going to turn on the mic because, by the way, if I did that, that would really be confusing and it wouldn't really work. So I'm going to turn those off for the sake of this session. And then what I'm going to do while that's connecting, so you see that's connecting, I'm actually going to open up, I have a demo here that actually includes if I'm joining from a mobile device. So I'm actually going to enable this software here, make sure this is available, it's connected. And I'm going to join screen mirroring. I have to reset this, pardon me. And forgive me, sometimes that app times out. So I need to redo that. It's a little app that I use for demoing mobile devices. So I'm going to move that over here. And then I'm going to get the browser back up again. Sorry about that. Okay, so there we are. Now I can demo. There we go. So this is now, I wanted to have this show side by side here. So this is my phone. I pulled up my Teams on here, and I'm actually going to pull up my Outlook because I sent myself the invite. So I want to make sure I received that invite. Here we go. There's the telehealth session. I'm going to accept this session. Great. And now I'm going to go back into my Teams. You can see that. So this is, and I want to show you this because I believe this is one of the things that it's beneficial to be able to know what the guest experience is or the patient experience is. So I'm waiting for this to hit my calendar. It hasn't integrated yet. So I'll just go back to Outlook and open it from Outlook. I was going to open it from Teams, but I'll just go here, test meeting here. I'm going to go ahead and join. So now I'm actually going to be joining this session here. Now what it should show, Yes, is that I'm waiting in the lobby, right? So notice I've turned off my mic and camera on purpose. I could probably turn on my camera if you wanted to see me twice, but that would probably be a bit boring. So anyway, but you get the idea. So here I am joining as a guest, right? And so now this is what my experience is in the mobile, but I'm over here. I don't have to let this person in. If you haven't experienced this yet, they basically pop up, say they're in the lobby. If I'm in the browser or on the app, I can basically say, hey, here's my participants. If you had multiple people here, you could see that. And notice it says outside the organization, even though it says Nathan Austin. This is my demo account, and this is my outside organization guest account as my tech joining. So this is where I could choose to just allow this one person, or if there's anybody else that might be sitting there waiting, I could have them join as well. Okay, so now I'm going to click admit. All right, so now I'm officially in the meeting. And I could turn on just for the sake of showing this, I'm gonna go ahead and allow the camera so you can actually kind of see that I am in the meeting, right? So you see me here and here. It's gonna be a little glitchy because it's sharing across multiple platforms and on the web browser. So forgive me for that. But one of the things that I wanted to show you is that here this is where I can turn on, actually when I click on up here, this is where I can click on chat. So I'm gonna go ahead and click on that. Show me chat here. I think I can do. Is it not allowing me to do chat? That's where I did it before. Sorry about that. So I'm trying to show the chat session. Is my finger? There we go. My finger wasn't hitting it right. That was my problem. So here's where I can type a message in the chat. Not that chat is anything that's spectacular, just to show the example of as a guest, I can actually choose to chat. The other thing I can do is I can actually upload an image. So let's say I did want to upload an image. I can allow access to my photos, and I did pick. I did have one file here that I wanted to be able to choose. It's just our MyTech logo, and say done. Of course, it's probably chose the wrong logo because it's on a black background versus a white clear background. But anyway, I can upload an image. The point is that as a guest, I'm going to turn off my camera here now. As a guest is where I can join, and then I can see that I typed a message and I was able to upload a photo to my provider. So that's just something that I wanted to be able to show you, that as a guest, I can join via mobile phone, and I can also then upload and chat if necessary. So the other thing I want to show you is that as a guest, I'm not able to click record. So if I click on this down here, which I clicked on little breadcrumbs, I'm not able to record here. So that's something, again, I just clicked down here, and I do not have the option to record. Now, if you're doing one of these sessions, you might not want to record, but if you do, if as the provider and as the organizer, I can record. So notice I just clicked on the same breadcrumbs that as a guest, I couldn't hit record, but here I can. So this is something I wanted to show as an illustration of the security settings that exist in doing a session like this. So, all right, so I'm going to go ahead and end the session. And I'm going to hang up the session here. And one of the things I wanted to show, as I'm still showing the guest screen, is I'm going to go to chat. And so this, the meeting is now ended. But what it says is you are no longer able to edit the chat. So this is one of those security settings that I mentioned, is that when you said the chat is only enabled in the meeting, this makes sure that your patients aren't trying to chat with you through this session when you're not in the session, because how that could be possible that this is, like you see on the screen here, if you didn't turn that off or enable only in the meeting, they could potentially try and contact you via this chat outside of it. And then if you don't have someone responding to that chat, then you could have a patient that's upset with you because they think you're not responding to their chat. So that's one of the reasons why I suggested to not give them access or only enable chat in the session. Okay, so that is pretty much the end. I just want to double check my notes here. Recording, yep, and the chat's no longer available. Yes, so that's pretty much it. So I will actually go ahead and stop screen sharing right now. Stop screen mirroring. and I'm going to go back to this content and say, all right, here's the deal. From a review perspective, that look, if you're going to do telehealth, look, there's a lot of things internally to consider way beyond the technology, but I would definitely recommend testing how this works, getting to know the experience of both the patient and the provider, so that whomever is going to be responsible for setting that up or helping your patients get ready or flag that first time user, and what are the things you need to do to get them prepared to be a part of a telehealth session. I do recommend documenting it. One of the things that I've learned over the years is that whenever I've thought, should I be more prescriptive or less prescriptive, the answer is nearly always more prescriptive as far as what you're expecting, especially those different settings that I was mentioning in the calendar invite, as far as choosing which setting is the best fit for you, for the lobby or not, and enabling chat or not, etc. Then I would also just review your workflow and documentation process. The workflow could mean having that flag that says, hey, this is the first time telehealth user. Make sure you do this extra work to get them to have an optimal session. It could be also saying, look, if you provider, be careful putting any notes or in the chat, or if there's anything that's like a file that's shared or a picture, et cetera, make sure to figure out a way to get that over into your EHR, EMR system, and then adjust, as needed, if that makes sense. And then, as I mentioned before, I would recommend preparing patient-facing content, whether that's a browser, a URL that you can have on your website, if that's a link that you share with folks, if it's a video that you host that you can send to them to be able to watch and walk them through it, or if it's someone guiding them through it and providing this content, depending on if self-help works or not. So those are the things that from our experience of talking with several different providers about their experience here, this is what we found that they recommended, what they went through that helped them navigate telehealth, and we thought we'd share some of that with you. So thank you for joining us today. Please follow us on LinkedIn or subscribe to YouTube. We post content at least every 2 weeks relative to Teams and Microsoft 365 and different industries that we work with, working on putting out more content like that. If there's any folks that that might be able to benefit from this content, by all means, please share the link. We'll be sending a follow-up email to everyone who registered and or attended to the event. We'll have links to the sources that we referenced, as well as a link to the recording. And by all means, join us at future events at mytech.com/events. That's where we post all of our future events, and they'll be available for you, as well as our monthly Power User Group sessions. If you have someone in your organization that's little tech savvy and they really enjoy helping your organization or adapt to things like we're talking about today, they are someone that we call a power user or a champion. We'd love to have them come to these sessions. They're free, but our goal is to help them be your internal advocates and your internal resource that can help you really navigate and adapt to these changes over time. So look forward to having those folks there. So finally, for those of you who are attending today, thank you so much for attending. For those who need to drop off, thank you so much and have a great day. For those of you who are sticking around, let's open it up for any questions if there are any.
Thanks, Nate. There are no questions right now.